Someone who taught me how to correct this problem properly was actually a medical doctor who was fascinated by osteopaths. He invited me to a medical conference where it was all a bunch of family doctors who were sitting in on a talk he was giving where he actually assessed someone live with this pattern, and he showed them step by step what to do in order to correct it. And the funniest thing is that once he showed them how to do this correction, I turned around behind me and they all were just wide-eyed and almost in shock because they saw a doctor doing manual therapy.
Are you ready to transform your health journey? Welcome to the Holistish Podcast, where science meets holistic wellness to help you take control of your health. I'm Lianne Balazsi, an osteopath with a background in psychology, athletic therapy, and occupational therapy, here to guide you through practical ways to feel your best without relying solely on doctor visits or prescriptions. Join me each week for deep dives, expert insights, and real-life wellness experiments as we explore the powerful connection between body and mind. Whether you're new to holistic health or just looking for fresh perspectives, you're in the right place. Let's start unlocking your healthiest, happiest self together. This is the Holistish Podcast. Before we dive in, a quick reminder. I'm an osteopath, not a medical doctor, and this podcast is for informational purposes only. The content shared here is based on my personal experience in education in health and holistic wellness. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions you may have about your own particular situation and your health. Okay, now that we got that out of the way, let's get on with the show.
So what if your low back pain or your heavy legs or even your monthly cramps had less to do with those isolated issues themselves and had more to do with possibly your pelvis being misaligned from a fall that you barely remember happening possibly in your childhood or even a few years ago? I asked this question because in my 10 years of clinical practice, I can confidently say that 80 to 85% of the people that have walked through my door have all had this common issue. They will have, most of them complain of a low back problem or a hip issue. And sometimes it goes deeper into, having bad cramps or trouble with your digestion or menstrual cramps. And because as an osteopath, you always have to check structure first because the structure governs the function. I go to see if the hips are balanced, and lo and behold, more oftentimes than not, I actually see that one hip is hiked up higher than the other. So in this episode, I want to cover one of the most common things that I see in my everyday practice. And chances are, if ever you end up on my therapy table, chances are, one, I've already assessed you for this, but you just didn't know it. Or two, I corrected it for you already. Or I should say we worked on it together because you have to accept what I proposed to your body in the first place. So I would like to talk to you today about traumatic hip. I define traumatic hip as someone who, it's a very common kind of pattern where it's happened either when you were a kid learning how to walk properly, or you're clumsy and you fall, or you're learning how to skate on ice for the first time, or you're just walking about your day in the wintertime and you slip and your heels slip out from underneath you and you end up falling on your butt. And chances are you don't fall evenly on both sides of your butt. You end up falling on one butt cheek more than the other. And that makes your ilium, which is the big hip bone that covers your whole hip joint, slide up and gives you an upslipped hip. And I like to call that a traumatic hip when it's in a case where you had a really big shock. So what will happen when this alignment is off, it'll look like one hip is higher than the other. It can be more subtle sometimes, but usually when I'm looking at someone and checking their posture out for the first time, the first thing I'm going to look for is whether their hips are even or not. So when it is off, you can have pain in your low back, preferably on the one side where the hip has been slipped. You can have hip pain on that same side where the hip is off, but you can also have it transferred to the other side who's trying to hold the balance all together. You can have more pooling in your legs just because your lymphatic drainage is lower. And you can actually have pain all the way into your knees or your ankles. And it can actually make a pattern of almost like a functional scoliosis. So you won't actually have a full diagnosis of scoliosis in your spine, but you will have a subtle S curve that's going up your spine to compensate for this unevenness in your hips. So I'm going to highlight a bit of the importance of all this and why we need to correct it. But I don't want you to start freaking out now and go, oh my God, I fell on my butt last week and now I have a scoliosis. This is not to make you guys panic. It is just to make you understand the deeper connections of sometimes you may have your body signaling that you have pain somewhere, and it could be from something that happened a long time ago, but it's okay. We can fix it. It's just we need to get to the deep understanding of why your pain is happening in the first place. So, funny enough, I learned more about this kind of pattern, not even necessarily from my osteopathic teachers, even though they did talk about this. Someone who actually taught me how to correct this problem properly was actually a medical doctor who was fascinated by osteopaths, and he loved treating backs, and he collaborated with osteopaths all the time. And he actually he invited me to a medical conference where it was all a bunch of family doctors who were sitting in on a talk he was giving where he actually assessed someone live with this traumatic hip pattern, and he showed them step by step what to do in order to correct it. And the funniest thing is that once he showed them how to do this correction, I was sitting in the front row, very enthusiastic to learn this technique from him. And when I saw him do the corrections, I was just like, oh yeah, that's just like what I saw in class, but he did a different combination that was very effective. And I just sat there and went, that's cool. But then I turned around behind me to see all the family medicine doctors who were in the talk, and they all were just wide-eyed and almost in shock because they saw a doctor doing manual therapy, first of all, and second of all, he was cracking. So even though probably doctors are probably the ones who are most allowed to do those kinds of things in this context, none of them seemed like they were willing to transfer that into their practice, which is actually quite a shame, because I'll never forget what this doctor told me. He said, and he was someone who assessed a lot of backs, and he was referring people for back surgery or not, and he actually told me that most of the time people who came to see him with a back issue, he would end up either doing that technique on them in his own medical practice, or he referred them to a chiropractor or to an osteopath, and he was actually helping them save the trouble of going through back surgery. So there was a lot of them who were either had gone to get a back surgery done and still weren't getting the relief they needed, and then he would perform these techniques and then they would feel better, or he would catch them before the surgery would happen and say, no, it's just a dysfunctional issue, and he would correct it, and then, they would praise him to the ends of the earth because he saved them from having to go through, invasive back surgery. I just want to iterate that we've all had falls in our lives, and it's possible we've all have this imbalance at one point or another. Because it's very easy, when you're a kid and you're learning how to do certain skills, even like little babies learning how to walk, we've all fallen on our butts. But just know that it can make your ilium slide up on one side, which will block your sacrum. So if someone's walking around and they're saying, oh, like one side of my back hurts, it's always interesting to make sure if they ever had a fall at some point. And these asymmetries are what create all this tension in your low back. But it can also create imbalances in your pelvis itself and can give you other issues within the organ area of your pelvis. So the reason why I want to highlight this is because when we learn about the pelvic balance in osteopathy, and I believe I mentioned in episode 2 all about the central chain, there are certain zones where there are certain reference points at certain points of the body where we should be able to find a perfect balance point where there's no tension at all on organs within the center. And one of those organs within the pelvis is called the isthmus of the uterus. And that's a narrow constriction at the junction of the uterine body, which is like the pear shaped of the uterus where, say, a baby will be held, and the cervix, which is where the exit of the uterus is. So the isthmus is in that junction point in between. So the isthmus should have absolutely zero tension on it. But if you start having a hip that's dysregulated and being shifted upwards, the uterus has ligaments that go straight from the uterine body all the way up to the iliums. So if you have the uterus that's got the ligaments going out and your hips off, already you're going to be pulling on the uterus to be pulled towards a certain side, and the isthmus is actually not going to be centered anymore and will have tension pulling towards that side. Not necessarily a dangerous thing. We're not talking like, oh my God, now your uterus is no longer functioning. That's not true. But it does affect the optimal function that it can have. It could lead you to have maybe slightly compromised circulation. So then you may already be prone to having menstrual cramps, and maybe that's something that can't actually change. But if you already on top of it have a pelvis that's dysfunctional, that's a bit out of alignment, your high chances you are going to increase that discomfort when the cramps kick in. In some cases, it can misalign your organs to a certain degree that it might just create a lack of efficiency. So it'll make you feel more swollen, more discomfort in general. It's just, chances are it can create an impact on your blood flow, your period efficiency, but also it can also affect how you go to the bathroom. It can affect maybe could give you some constipation. So I say these things just because I want to make sure you understand that structure governs function. And sometimes you can have these issues that pop up, and there might actually, when you go for testing, there might nothing be wrong with you. Like, oh, I have constipation, I don't understand why. But all of a sudden we realign your pelvis after a traumatic event, and all of a sudden everything flows better, or your period cramps go down. So I have a lot of people where this happens to. But it marks me every time that someone comes to me and they say like either they have a hip problem or they have a low back problem. And I do have it in my personal practice to always check for this. But sometimes the story can veer me off and I just think, okay, maybe it's something else. And I always check for it, but sometimes it doesn't pop up right away. So in the first appointment, if it doesn't pop up, sometimes I'll admit I kind of forget that, okay, they must have not had that issue. But it does happen where you may have to unlock some other things of a layer of the onion first, and then you finally get through that first initial layer, and then underneath it, you'll find a whole bunch of traumatic patterns and being a traumatic hip. One thing that can be tricky is sometimes you'll correct for a traumatic hip, and then you'll retest, and you'll see that you actually have to correct the other hip as well. And you realize someone had a double pattern. This actually happened to me, but funny enough, when you first tested me, I had chronic low back pain for years. And when I got that first correction of my hips, I didn't believe him that it was traumatic hips on both sides, even though with my figure skating history, it made perfect sense. I would do sit spins all day, every day, and fell on my butt a lot. But when you would measure my hips initially, before moving me around and everything, my hips were even. But it was only once you correct one, and then all of a sudden that I was one hip being normal and the other one not, you saw the imbalance, and finally he corrected the other, and then I really felt like what pain relief was. So sometimes it can pop up in the first appointment as the very first problem that you have to address, but sometimes it'll pop up later. So you don't get mad at your osteopath if they don't find it the first time. Sometimes the body is very good at kind of tying it all up and hiding it through something else. And then once we unlock the layer above that, everything starts to reveal itself. Other things we have to consider when it comes to a traumatic hip is there's other kinds of impacts it can have if it doesn't get corrected. So some people like to think of this on the energetic level of the chakras. So in the pelvis area, you have the root chakra and the sacral chakra. So you may not necessarily have low back pain or, pooling in your legs, but maybe you have something more in the sense of your inability, say if you like to meditate and you can't seem to ground yourself and sit properly in your sit bones. You don't feel stable by putting pressure down into your pelvis and into your hips to sit. Or for some people, if it's more in their sacral chakra that gets affected, it could be their creativity. They may have impacted on their sexuality. And it could be also just in their energetic flow of everything passing through their inner canal of energetics. Now, I don't necessarily know how to assess this personally, but I just hear other people speak of this when they come to see me in treatment and then they go, oh my goodness, I feel finally like this chakra has opened up. I feel like I have flow here now. I feel grounded is what they'll tell me when we correct this. So how do we go about correcting this once we've detected this issue? So usually once it's detected, we'll do a standing assessment to see, oh yeah, that's off. Functional assessment where we have you bend over to see if things are moving, have you lift your knee up to your chest to see if things are moving right. And then on the table, I will recheck everything to see if it's the same pattern lying down. And when it's something traumatic, usually it'll be consistent across standing, sitting, and lying down. In this case, I usually do mostly standing and lying down, and it usually gives me the full picture. So funny enough, in order to correct that, we usually have to, you got a blunt force going upwards. So now we have to reverse it. So I actually have to pull somewhat aggressively on your leg. And it actually is very effective. But if you're nervous about getting your leg pulled and you resist, it can create some resistance and not make the intervention as effective. So there's a lot of trust that has to go into the person who's going to do this correction on you. Now, funny enough, when you do this day in, day out to other people, and then you detect it on yourself, sometimes if you don't have another osteopath around you, it's hard to get someone else to do it for you. But I digress. There has to be trust on both sides. The person pulling has to trust they know the right amount to pull, but also the person receiving that pull has to be able to let go enough for you to do the actual movement. It all sounds really aggressive, but it's actually just very specific and targeted, that the actual correction is not as rough as it may sound. So just to give you some reassurance if ever you have to have that corrected. So once that gets corrected, then we have to make sure that everything surrounding the pelvis is now back in alignment. But if that was really the primary issue, usually you get a really good unlock after we have to correct maybe a vertebrae or two. We got to undo the functional scoliosis. And then we kind of just integrate you and let you run with that. So if you have a recurring low back pain issue and you also have a history of falls, you either had some, you were a figure skater like me, or you had a fall one winter and slipped and fell on your butt, or any other kind of fall of that matter, be sure to mention that when you go to either see, not necessarily an osteopath, but if you go see a chiropractor or you go see a physiotherapist, make sure you bring up that these traumatic falls may have happened, because it paints a whole different angle to the story on when we're trying to figure out how to best serve you. So just in closing, I want to emphasize that the pelvis is not just your hips per se. It is really the foundation for the whole balance of you standing with your 2 feet on the ground. If your pelvis is off center, already from the get-go, you're messing up your whole balance in order to fight gravity, and that's when the postural problems are going to start to kick in. So if this is something that you would like to get checked, I would highly recommend you hit the link in the show notes in order to help you find an osteopath in order to get this assessed. The link is only for in Canada, but you can feel free to DM me on Instagram, and I can help you find someone in your area if you need extra help or support to find someone near you. So with that being said, I will leave it there for now, and I'll see you next week.
Thank you for being a part of today's episode of the Holistish podcast. Ready to take your wellness journey further? Visit Holistish, that's holistic with an SH at the end, .com, to access our latest resources and wellness tools designed to support your holistic health journey. For holistic health inspiration and a behind-the-scenes look at integrating traditional wisdom with modern wellness, join our growing community on Instagram at the.holistish. If today's episode resonated with you, subscribe so that you never miss out on our weekly episodes, and leave a quick review to help other wellness seekers find us. Until next time, stay curious, stay balanced, and keep exploring what works best for your unique body and mind. Your health journey matters, and I'll meet you right back here next week.